This is part 3 of the balance series. Part 1 gives you an overview of what you can do to help your balance. Part 2 discusses balance reflexes when you're feeling unsteady in a standing position and what you can do about it. This is part 3, and it has to do with low blood pressure in Parkinson's, which is called orthostatic hypotension. The main purpose of this video is to help you recognize the symptoms of orthostatic hypotension so that you can manage it better. Did you know that approximately 30% of people with Parkinson's have low blood pressure when standing? It's more common in the later stages of Parkinson's, but it can also be present in the early stages. You may have low blood pressure but not know it, since many individuals don't have symptoms. If you have low blood pressure from Parkinson's, there are things you can do to help yourself. In this presentation, I'm first going to talk about what orthostatic hypotension is and how Parkinson's can affect your blood pressure. Then I'm going to talk about the symptoms you may experience when your blood pressure is low. It's good to know what to look out for because then you can bring it to the attention of your doctor and then address these issues. Next, we will discuss how orthostatic hypotension is diagnosed. And lastly, the majority of this presentation is to learn what you can do to help reduce your symptoms. So what is orthostatic hypotension? When a person stands up, gravity pulls blood down into the lower limbs of the body, which can lower the blood pressure. Most people's bodies are able to begin increasing the blood pressure again quickly. But when people with orthostatic hypotension stand up, their blood pressure drops and it stays low. There's many reasons why people have orthostatic hypotension. The first one is dehydration. There's not enough fluid in our system, and I think generally most of us don't drink enough. So that's one reason. Another reason is due to aging. As we get older, our blood vessels don't respond as quickly or robustly, so that can affect our blood pressure a bit. There's side effects of certain medications that can lower our blood pressure, so that needs to be looked at by the doctor to see if that's contributing. Then there's various heart conditions which can contribute to low blood pressure. And lastly is the underlying neurologic cause, and that is pertaining to Parkinson's and similar movement disorders, and that's going to be the focus of this presentation. Normally, the nervous system sends signals to your blood vessels, which then contracts the blood vessels and helps bring your blood pressure back up. In essence, it's like squeezing a tube of toothpaste. Now with Parkinson's, you're not getting those signals, so then the blood pressure doesn't go up and it stays down. The initial criteria for orthostatic hypotension is a fall in blood pressure that occurs within 3 minutes of standing. Now the systolic blood pressure needs to drop greater than or equal to 20 millimeters of mercury, which is the top number, or the diastolic needs to drop greater than or equal to 10 millimeters of mercury, which is the bottom number of your blood pressure. Now, sometimes it can be not so clear. There isn't much of a drop, where an individual may need to stand longer, 5 to 10 minutes, so your healthcare provider can further assess more definitively if you have orthostatic hypotension, as some individuals may have a little bit of a delayed drop. So what happens when your blood pressure is too low? Why do we even care? Well, the one thing is it makes you less steady when you're standing or walking, and it can contribute to falls. It can actually double your fall risk. It can also contribute to cognitive impairment, where you feel a little bit confused or unable to think clearly or feel a little bit foggy. All of these symptoms are typically exacerbated when you're standing and walking. Now we're going to take a look at what your symptoms are. Now, symptoms from orthostatic hypotension will emerge when you're standing or walking and will go away when you're sitting or lying down. For example, if you feel woozy or you have dizziness when you stand up and you start walking, but then when you sit down or lay down, those symptoms go away, that can be due to orthostatic hypotension. Another example is fatigue with standing. So When you're standing, you feel more fatigued. Now, this is different from the general fatigue that many people have from Parkinson's, where you feel fatigued all the time. But in this circumstance, when you're standing and walking, you just have a greater level of fatigue that you're feeling. But when you sit down or lie down, it goes away. So pay attention to that and see if it's the fatigue that you may experience from orthostatic hypotension or if it's the general fatigue that you experience from Parkinson's. Then there's lightheadedness. Do you feel more lightheaded when you're standing and walking? And then does it go away when you're sitting and lying down? Again, there's that same pattern to look out for. Some people experience a sensation where their legs feel weak or they feel that their knees are going to buckle. And it's really not a true weakness. It's more a symptom of orthostatic hypotension. And then this feeling of weakness goes away when you sit down or lie down. Then there's symptoms that are also related to oxygen hypofusion. So the structures that you feel symptoms in have reduced oxygenation just because your blood pressure is lower. For example, the blurred vision. Do you have blurred vision or tunnel vision where you just can't see as well, but it goes away when you're sitting or lying down? And similar with difficulty with breathing, that's another hypofusion area, so that when you stand up or you're walking, you get a little bit more short of breath because that reduced oxygenation to that area. But then when you sit or lie down, it goes away. So pay attention to the symptoms and pay attention if they go away when you sit or lie down. That's the key. There's another symptom called coat hanger pain, and that's pain in the back of the neck and along the upper trapezius area, or if you want to call the upper part of your shoulders there, however you want to word it. I had a patient that had this symptom. Whenever he would get up, he would have some discomfort initially in his neck and upper trapezius area, and then he would start walking and it would get so intense he would have to sit down. But when he sat down, the pain went away. So that would be an indication that this is a blood pressure problem and not an orthopedic problem. In addition to knowing what your symptoms are, we want to know, when do your symptoms occur? Now, we know that your symptoms are occurring when you're standing up and walking, but there are other circumstances that can contribute further to your exacerbation of the orthostatic hypotension. Do your symptoms occur after taking your medicine? That might be an indication for your doctor to take a look at your medications if they're contributing. Are your symptoms occurring with exercise? Perhaps you're not drinking enough before you start exercising. Is it occurring after you've eaten? Are you eating large meals? So these are all things that we can address when we know when you're experiencing these symptoms, so that your healthcare provider can help fine-tune and improve control of your orthostatic hypotension. Now that you know what symptoms you're looking for, keeping a log to share with your healthcare provider can be very helpful. Now, this is something that you don't have to do on a daily basis or long-term, but just for a couple of days, just to get an idea on what's going on with your symptoms and when they're occurring. If your healthcare provider suspects that you may have orthostatic hypotension, they're going to screen you with questions related to the symptoms that we talked about earlier and when you experience those symptoms. If you've answered yes to any of their questions, they will proceed to take your blood pressure. Practically speaking, they'll take a blood pressure in a seated position after you've been sitting at rest for about 5 minutes. Then they're going to have you stand up and take your blood pressure initially when you stand up and then 3 minutes later. If your blood pressure doesn't change much, they may have you stand a little bit longer. And then this way they can see if there's been blood pressure drops and if you fit the criteria. Sometimes they'll have you lay down and take your blood pressure and then stand up. It just depends on the practical situation. If after seeing this video you feel that you have symptoms that are similar to orthostatic hypotension, let your healthcare provider know so that they can evaluate for this to rule it out. After having your blood pressure taken and completed all the testing necessary to determine if you have neurogenic orthostatic hypotension, now we need a plan of action to reduce your symptoms so you can be more functional and steadier. The first step of this process is a medication review, and the doctor will look at all the medications that you're taking and see if there are some that can be reduced or eliminated that may be contributing to your orthostatic hypotension. One example of this is somebody that when they were younger, they had high blood pressure. They started taking blood pressure medicine to bring their blood pressure down. Now later on, they were diagnosed with Parkinsons, and now they started taking Parkinson's medications, some of which also lowers your blood pressure. So accumulatively, it's bringing your blood pressure even lower. Sometimes the timing of your medicine can be important. I had this one individual who was taking his blood pressure medicine and his Parkinson medicine all in the morning, and that's when his symptoms were the worst. In either case, your doctors would make the appropriate adjustments. For example, your cardiologist or internist would make the adjustments unrelated to your Parkinson's, and then your neurologist would be making the adjustments related to your Parkinson's. So the first step was up to your doctor to make adjustments in your medicines. The second step in reducing the symptoms of orthostatic hypotension is up to you. It's making lifestyle changes. In other words, changing your habits and how you do things so that you can reduce your symptoms. One of the most important lifestyle changes is simply drinking more, making sure that we're hydrated. The more fluids we drink, the more it helps our blood volume, the more it helps with our blood pressure. So this is a very important aspect. So how much more water should we drink? Well, as a rule of thumb, the recommendation is at least 2 liters of water a day. So that equates to about 8.5 cups. And at this point, everybody's eyes is probably getting quite large because you're thinking, that's a lot of water to drink. But there's ways to chip away at it, so it's a little bit more doable. When I was younger, and I was told I needed to drink 8 glasses of water a day for hydration, I had envisioned 8 tall glasses of water a day. And I was thinking, I'm just never going to be able to do that. So I never attempted to do it because it felt overwhelming. But take a look at this. If you think of 8 cups a day, you take a measuring cup and pour water in the measuring cup, and then take that measured cup of water and pour it in a glass. And it's not as bad as you think. So one thing that you can do, and it's recommended that you do it anyways, is whenever you take your medicine, take it with 8 ounces of water. That's 1 cup of water. And what helps, a lot of times people have a little bit of a dry mouth. So before you drink the water, take a couple sips of water to just moisten your mouth so the pills don't stick in your mouth. Then put the pills in your mouth and drink it with 8 ounces of water. That's really important so that your medicine doesn't get stuck in your throat. It goes to your stomach and starts doing the work that it needs to do. Now in therapy, some patients have come in and it's time for them to take their medicine. I say, okay, I'll get you some water so you can take your medicine. It's like, oh no, I just put it in my mouth and swallow it. Well, then it gets stuck in their throat and it's not going down and it's not doing the thing it's supposed to. So some people, they complain about, I take my medicine, but it doesn't kick in for a while. And that might be one of the reasons. So every time you take your medicine, take it with 8 ounces of water to make sure the medicine gets all the way down. If you take your medicine 3 times a day, that knocks out 24 ounces of water. So that's one of those bigger containers. If you're active or live in a warmer climate or you exercise and you're losing a lot of fluids through sweating, you want to make sure you replenish your fluids so that you'll end up probably drinking more than those 2 liters, which would be the minimum. Now that you've established about how much you need to drink a day, now it's a matter of keeping track of how much you're drinking. So you need to find out your routine that makes it easy, and once you've established that, it won't be bad. Some of my patients like to keep track by using a pitcher, and that seems to work for them. You can also buy a liter carafe, which has a wider grip to it, and that might be easier for some people to use. And then there are the water bottles that are very practical as far as bringing the water with you wherever you go. And then you have your water with you if you need to take your medicine. This is the last slide talking about water, but it's a very important slide. Studies have shown that drinking a glass of water over a short period of time can help alleviate symptoms for the short term. For example, if you drink 8 to 10 ounces of water over 5 minutes, you can start feeling better in about 10 to 15 minutes, and your symptoms can subside for all the way up to an hour. So that's a nice quick fix if you feel symptomatic. Studies have also shown that drinking 16 ounces of water reaps more benefits, but 16 ounces of water is a lot to drink in a short period of time for some individuals. So for practical purposes, what I would try is first drinking the 8 ounces of water and see how you respond to that. If you have relief of your symptoms, then you're good. Then you can drink 8 ounces of water over a short period of time when you're symptomatic. If that isn't enough, then try the 10 ounces of water and then work your way up so that you're only drinking what you need to relieve your symptoms from a practical perspective. I have to say from personal experience, when my patients would come into therapy symptomatic, I would have them drink 8 ounces of water, and in 10 or 15 minutes, their symptoms would be relieved. And also, I took their blood pressure before and after they drank the water, and their blood pressure also improved. After all this talk about water, I'm sure you were thinking about bladder control and where are the toilets. If you are having trouble with bladder control, there are pelvic floor physical therapists who can help you improve with your bladder control. Another thing I ran across recently are actually apps that show you where there are public bathrooms, which can be very handy if you're in an area that you're not familiar with. So the first lifestyle change that we talked about was drinking more. The second lifestyle change is avoiding straining when you're having a bowel movement. What happens is that brings your blood pressure up while you're straining, and then when you're done straining, it drops, and then you could become symptomatic. Constipation is relatively common in people with Parkinson's, but here are a few things that might help. Of course, it's drinking more that helps, and exercise and walking helps stimulate the bowel. And then also your diet. You want to increase the fiber in your diet with fruits and vegetables or anything that has high fiber. Another thing you can try and do to reduce straining when trying to have a bowel movement is using a bathroom toilet stool. There's also a commercial device called a squatty potty. And what that does is it positions you in a squatted position so that your colon is more straight, and then it's easier for your stool to pass through. When you're just sitting up straight without squatting, your lower colon is kinked. And part of it is because the muscle going around it is tense. Now, when you use the bathroom toilet stool and you squat, you lean forward and the stool's bringing your knees up, it straightens out your lower colon to allow easier passage of your stool. Another lifestyle change is instead of eating large meals, you want to eat smaller meals more frequently throughout the day. Large meals that are high in carbohydrates can cause greater blood pressure drops. So what happens when you eat a large meal, your body diverts blood to your digestive tract, and then that lowers the blood pressure throughout the rest of your body, and then you can become symptomatic. If you continue to have symptoms when you eat your meals, try drinking a glass of water over a short period of time before you eat your meal and see if that helps. Some people may need to do that twice. So you have a glass of water before your meal, drink it over a short period of time, and then during your meal, do that again. And it just depends on what your needs are. Some people don't have to do this at all, but if you're symptomatic, it's worth a try and see if it helps. Next, you want to limit your alcohol intake because alcohol works as a diuretic, so then that can lower your blood pressure. And lastly, you may want to limit your activities after eating because your blood pressure may be lower, and it just depends on how you feel. Two of the most effective lifestyle changes is, you guessed it, drinking more water, staying hydrated. And the second one is using some external compression in your abdominal area to help control your blood pressure drops. So those are the two main areas to capitalize on. Normally, the abdominal circulation makes up 25% of your total blood volume. Now, when you eat, that percentage increases because the circulation is diverted to there to digest your food. And that's where the compression garment comes in. It gives that counter pressure against your abdominal area, in essence, like you're squeezing a tube of toothpaste, and it helps control your blood pressure. So this is an example, very archaic, but if you put compression in the abdominal area, you can see how it pushes the blood up so that it will help control your symptoms. Here are some examples of external compression for the abdominal area. So you have your abdominal binder. It's kind of practical where you can just Velcro it closed and take it off whenever you don't need it and put it on when you need it. Another alternative is wearing the compression shorts. Now, for some people, that's more practical than the binder. For other individuals, they like wearing the shorts. It's more practical for them. So just see what works best for you. Just some caution with wearing the compression shorts. This may make your varicose veins worse if you're having problems with that, but that's something you would just observe and see how you respond. Compression stockings is another option that you can use to reduce the pulling of the blood into your legs. It's that counter pressure that helps bring your blood pressure up. Depending on the symptoms that you're experiencing from your orthostatic hypotension, your doctor may prescribe compression stockings. There are medical conditions that would be contraindicated for using compression stockings, and that's why you should not just go out and buy them on your own. Make sure you clear it with your doctor. The waist high is most effective because it covers your abdominal area and it has the most coverage on your legs to give that counter pressure. And then there's the thigh high, which works better than the knee high, but it's keeping it up around the thighs can be problematic. And then there's the knee-high compression stocking. People like these simply because they're a shorter stocking. They are still difficult to don because of the higher compression in these compression stockings. Research has indicated that the knee-high compression stockings are not effective, but I have had individuals who have had milder orthostatic hypotension who have found them beneficial. Regarding lifestyle changes, we first talked about drinking more water, then we talked about compression garments. Now we're going to talk about getting out of bed. So when you're getting out of bed, you want to get out of bed more slowly so your body can adapt. And then once you're sitting up, make sure your feet are flat on the floor because that helps the muscle tone in your calf muscles, which helps keep your blood from pooling. So here's just a mini video showing that. When you first sit up on the edge of the bed, pump your ankles and pump your fists. The pressure from your muscles helps reduce the pulling of the blood into your extremities. Here's a little video just to show you how to do it. If your bed is too high, it can make a difference when you initially sit up because your legs are just dangling, and then that allows your blood to pull down into your legs. But if your bed is a lower height, that allows you to get your feet planted on the floor, which helps with your blood return. If you want to learn different avenues on how to lower your bed, you can take a look at this video on my YouTube channel or on my website, parkinsonspt.com. It's Bed Mobility Part 1, Bed Height Matters. Generally speaking, people tend to become less active when they start experiencing orthostatic hypotension symptoms. Inactivity can reduce your sensitivity of your blood pressure system, which is needed to respond to position changes and can actually worsen your symptoms. Which brings us to exercise and some exercise considerations. We need to keep in mind the importance of strength and flexibility in order to perform our daily activities. One of the things you can do is to drink before you exercise, because as you exercise, you get more dehydrated, so you want to stay ahead of that. Then you want to perform your exercises in a seated position if you don't tolerate the standing position. There is an optional mode of performing pool exercises. Now, the hydrostatic pressure of the water helps keep your blood pressure a little bit more normalized, so you're not as symptomatic. So for some individuals, this might be a good avenue of exercise. But then for other individuals, the thought of getting dressed into a swimming suit, which is a lot of work, and then getting into the pool, and then getting out of the pool, and then getting dressed again may just not be worth it. Working with a physical therapist to establish a home exercise program that's customized to your needs can be advantageous, both restoratively and preventatively. Another lifestyle change is trying to avoid getting overheated. So if it's a hot, sunny day, you want to limit your time that you're outdoors. You want to drink more. If you can, stay in a shaded area. If you have access to a fan and you don't have air conditioning, use a fan. But just the bottom line, use common sense methods of staying cool. When you get overheated and you start sweating, that does affect your blood pressure and that can affect your symptoms. In regards to bathing, you want to avoid taking hot baths or hot showers. This will dilate your blood vessels and cause your blood pressure to drop. Another thing you can do is consult with an occupational therapist to see which solutions are safer for you. And some of those things entail either figuring out where to place grab bars or establishing seating for the bathtub or the shower. If you find yourself out and there's no place to sit down, there's some physical maneuvers that you can perform. And one of them is bending down a bit and pressing on your abdomen as you're squatting, and that can help bring your blood pressure up. And here's just a brief video of how that would affect your blood pressure. So pushing on the stomach, see how the blood is going up a little bit higher. This is not very scientific, but it just gives you an idea. Another maneuver that you can perform is crossing your legs and tensing up the muscles in your legs. So you give that compression to your blood vessels, which helps bring your blood pressure up. Crossing your legs and standing like this can be quite destabilizing for many individuals, but it can be effective. Let's say you're in the grocery store and holding on to the shopping cart. That's something that you could do. There are other individuals that really need to sit down quite rapidly if they start getting symptomatic. And the best way to address that is using a walker so that if you are symptomatic, you have a seat with you right away and then you can sit down. Increasing your salt intake by 1 to 2 teaspoons a day can help with your blood pressure. But you really should get approval through your healthcare provider, because some individuals have a history of congestive heart failure or excessive edema in their extremities, and this can exacerbate those conditions. Did you know that approximately 45% of the people who have low blood pressure from Parkinsons also have high blood pressure when lying down? This is called supine hypertension. The first part of the presentation, we talked about low blood pressure, and now we're going to start talking about individuals who have problems with high blood pressure when they're lying down. We're going to talk about some lifestyle changes for supine hypertension, things that you can do from a practical perspective to help minimize the high blood pressure. If you're an individual who needs to rest during the day, that's fine, but instead of lying down on the bed, use a recliner. If you have your feet down while you're sitting in the recliner, that would be better than being in a recliner with your feet up. Or you can put a stool under your feet with the recliner if not having a stool is uncomfortable. Now for nighttime, what you can do is, if you have an adjustable base bed, you can bring up the head of your bed so it's about at 45-degree angle to help minimize the high blood pressure at night. Another option is placing bed risers at the head end of your bed so that the head end of your bed is 6 to 11 inches higher than the foot end of your bed. And then another option is using a wedge so that your head is higher than your feet. This is what a bed riser looks like. The feet of the head end of your bed goes into the bed riser, so it kind of cups the leg of your bed, and then that helps stabilize it. If you have wheels on the legs of the foot end of your bed, make sure they're locked or remove them and put some non-slip rubbery substance underneath it so that it doesn't slide. Some of my patients who have opted to use bed risers or something like them have often complained about sliding down towards the foot end of their bed. Here are two options to protect you from sliding down to the foot end of your bed. The one on the left is called a bed foot support, and then the one on the right is called a bed footboard. The one on the right is only sold in the UK. So after looking at these for a little bit, I was thinking people could probably make some homemade devices to help block their feet. And what you would need is a strap that would go all the way around your mattress, and then have something that will block your feet, but you want to secure it with that strap. So just food for thought. So here are the last few lifestyle changes for supine hypertension. You want to avoid drinking a large amount of water over a short period of time, 30 to 90 minutes before going to bed. The only exception to that would be if you needed to take medicine before going to bed. Then you would drink it with 8 ounces of water so that your medicine can get to your stomach to do the things it needs to do. Then also with having your bed tilted, it can help reduce the frequency of urination at night. And then as a result, it can improve your blood pressure in the mornings, which is typically low. So to summarize, once you've been diagnosed with orthostatic hypotension and you have Parkinson's, the first step is the doctor will review your medications and make adjustments as appropriate to minimize your symptoms. The second step is making those lifestyle changes that we were talking about, things that you would do to minimize your symptoms. Now, if those two combined are not effective enough to help reduce your symptoms, then the last step would be adding additional medication specific for your blood pressure. If you want to see more videos like this one, go to parkinsonspt.com and then click on the tab that says YouTube. Thank you.